Hi guys, my name's Ethan. I'm a registered nurse at the Huron Regional Medical Center. I'm from Waverly originally, my hometown, but I went to Watertown to complete my LPN nursing license and then attended for my associate's registered nurse license. Upon completing college, I then came to Huron, moved down here, and have been working at the hospital ever since. I've been a registered nurse for about a year and a half, and I've been working on the medical surgical floor. I really enjoy my job up there and enjoy spending my time with patients, advocating for them, working with the physicians here in town. And you really just kind of get a community in that small town hospital. I currently am orientating to the ICU and ER, and I enjoy that experience as well. When we do have patients come in, you send me over to the ICU. It's a lot more critical care, a lot more critical thinking. You handle the patient one-on-one. And when you go down to ER, it's just everything's so different. You just don't know what's coming in, and that's kind of the fun of it, the surprise and such. We also have a specific COVID ward, like other hospitals do. I'm sure you guys might have heard about that with nursing, and my wife and I are actually some of the COVID nurses that are usually put back there first. Just being younger nurses and such, it's always really interesting because with COVID patients, you just try to keep their voice to the rest of the world, it seems like. I chose this occupation because I was looking at the jobs and such, and job security was always something that I was really worried about going into the future. There's so much you can do with nursing. If you want to work in a hospital, if you want to work in a clinic, nursing home. And I was just really worried as a high school student. I didn't know if I apply for a college or go to college, am I really going to get the job? Or is there going to be a job waiting for me? With nursing, I have just a really sense of security, and I feel very comfortable with my career choice. With this last year with COVID, we've seen a lot of mental issues and such come out of it, not just with the patient's family. It's been just heartbreaking for a family when their loved one has to spend a Thanksgiving away, or in the holidays if they have to miss, let's say a kid wants to go trick-or-treating with their child, they have to be staying in the hospital. It's just been a real strain on families, and just being there to support them and be there for them has been a big part of nursing for me. What I like most is just getting that relationship with your patients, advocating for them, and making their stay as comfortable and the best for them as possible.